good morning and welcome. And I am Dr. Peter Holmes, orthopedic surgeon, and I am host of your program, Ask the Doctor. My guest this morning is Dr. Sammy Vick. Dr. Vick is a urologist. If you have any questions for Dr. Vick in the future, any of my other guests, two ways to reach me. Do it through the foundation at needfoundation.org or fax 696-9012. Hey, let me tell you something. I saw what could be the future of American medicine years ago. I had a friend whose mom lived in England. She was 80 years old. 80 sounds old, but you know what? Every day she'd walk 1 mile to town to get her bread and then come back home. Well, one Sunday she didn't quite go to get her bread, and so they checked on her Monday and they found her at home with a broken hip on a Monday. So Monday, they bring her to the emergency room, bring her to the hospital. The crew that works Monday orthopedically wouldn't be back till Wednesday. The Wednesday team then brought her to the operating room on Wednesday to fix the hip, at which time there was a car wreck in the city with more people hurt, but they were young people. So they brought the young people in. They woke up this 80-year-old, did fix her hip, put her on the floor, fix the young people. Now comes Friday. That's when the team comes back. They bring her back to the operating room now on Friday, and they put her to sleep and fix her hip. Her son, who happens to be a physician here, flies over to England. He gets there on Saturday. His mother is on the floor, 80 years old, after being put off all this time and been put to sleep this many times, and she's laying there near death. This doctor asked, just like we would, why is she not in the ICU? And the answer is, doctor, she's over 59. We're not allowed to put patients in the ICU over 59. I've seen American medicine from what I can tell. Quote, this comes from the politician, our Medicare spending needs to be controlled. What do they mean, Medicare spending needs to be controlled? Well, there's two ways to do it, prices or volume. Now, our prices can't be cut anymore. I'll tell you right now, it's at rock bottom. If they cut Medicare anymore, no physicians are going to be seeing Medicare patients. I've been told if they go through the 10% cut 6 months from now, stop doing total hips. So the prices are getting near rock bottom. So we talk about volume. Now, when you talk about cutting volume, that means rationing. Volume cut means rationing. In other words, you're going to do X number of procedures down to Y number of procedures to so-called cut costs. Okay, so here we go down the slippery slope. How are we going to do this? Let's see. We're going to say anybody over 80 shouldn't get cardiac bypass procedures. Okay, then the next year there's more and more elderly entering Medicare, and the budget doesn't quite keep up with that increasing aging population, so it's quite easy. Once you start the slippery slope, anybody over 79 doesn't get cardiac bypass. Or let's do it the other way. Let's say we'll base it on sickness. Okay, so like they do in Canada, they have 5 phases for bypass procedures. And the sickest ones don't get done at all because they don't think they'll make it. And the ones that aren't quite so sick don't get done because they don't quite need it, they think. But who's deciding? And probably a few of these people do need it. So they have the group in the middle that sort of get done based on rationing and the number. By the way, many cardiovascular surgeons have met their rationed amount about July or August and quit doing them and have to move or come to the States to do Canadians. Again, you've decreased the cost of health care by decreasing volume. Decreased volume means rationing. And folks, this is coming along. It's not your fault. They took our Medicare and Social Security monies, all the excess, and they're still doing it, and they're spending it in the general budget, and they're not saving it for the aging population. So it's their fault. So when you hear we need to control the costs of Medicare, it's a broken system, that equates to one thing, rationing your health. These are my opinions. Any comments? Two ways to reach me. Get me on the foundation, which also helps my uninsured athletes at needfoundation.org, or fax 696-9012 to ask the doctor.